to the Oral Health Education Series, created in part by Ready, Set, Smile. My name is Dr. Brecky, and I'm a practicing dentist in northern Minnesota who also has a background in public health from Columbia University. I'm going to serve as your guide throughout this 9-module series to provide you with an overview of topics related to oral health and dental care. We'll start today with Module 1, Introduction to Oral Health. Introduction to Oral Health serves as an introductory module to this oral health education series. Permissions for the use of images in these modules were obtained via Canva, Shutterstock, and Dr. Brecky. This material is subject to copyright. Throughout this series, we will provide you with a review of all topics related to oral health and dental care. And the purpose of this oral health education series is to provide you with the tools and resources to become a successful oral health educator for others. Well, who are you? You are the individual who has access to speaking to and educating other populations, whether they include young children, whether they include older adults, or any other populations who are particularly vulnerable for dental disparities. You might be a nurse, a speech pathologist, an occupational therapist, a community health worker, a social worker, a nurse's aide, a physical therapist, or even an MD. You are the individual who has access to serving as an educator for others who don't have a high knowledge of oral health related topics. The oral cavity or mouth is a fundamental part of our social, behavioral, and biologic experiences of living. In fact, the oral cavity serves as a unique lens through which one can view the overall health of an individual. Many systemic or full body diseases have oral manifestations, or you can see them when you look in the mouth. These include diabetes, eating disorders, autoimmune conditions, cancers, HIV/AIDS or other infections, malnutrition, substance abuse. Now, this is not a complete list, but those who have access to peeking into the oral cavity may help to locate or diagnose some of these conditions. So today we'll review an introduction to the oral cavity, and this includes the anatomy of the mouth, the biology of the oral environment, diseases of the oral cavity, topics covered throughout this series, and basic prevention of oral diseases and conditions along with oral health instructions. It's never too late to relearn how to brush your teeth. So what is so important about our mouths and teeth? Well, smiling, communicating, speaking, breathing, eating, even protecting, and engaging in romantic behaviors. Yep, it's that important. We use it every day, all day. So what are the determinants of oral health? Well, these are broken down into 4 big components, including genetics, environment, access to dental care, and health behaviors. What are genetics? These include things like biological factors, our race, our ethnicity, or our sex. Our environment includes what surrounds us, our local community water supplies. Do we have well water or do we live in a city? Our geographic location. Are we rural or are we in an urban environment? Access to dental care includes things like health coverage or income level, or even just access to a dental office. And lastly, health behaviors, which may play the biggest role in a determinant of oral health. And these include things like our cultural norms, our learned behaviors throughout our lifespan, even our educational background or our systemic health, our overall health. This is a complex kaleidoscope of factors which influence our overall oral health. So a brief review of oral anatomy. The oral cavity includes the lips, the teeth, the gums, the tongue, the soft and hard palate or the roof of your mouth, the floor of your mouth, your throat, the supporting bones including the maxilla and the mandible, and the temporomandibular joint. That's a long one. Surrounding soft tissues, gums, or hard tissues, like bones, of the teeth are called periodontia. And importantly, enamel is a term you hear often, and that's the outermost component of the tooth surface. It comprises the crown of the tooth, and it is the hardest substance in the entire body. Just remember, teeth for children, there are 20, whereas teeth for adults, there are actually 32. Yep, we get 2 sets. We are very lucky. And I know this is a lot of information, but we'll go into more detail as the lectures go on. So let's review the oral anatomy of the mouth. Like I said, this includes the lips, the tongue, the soft palate, hard palate, roof of the mouth, the uvula, you can see that here. And it also includes the teeth, starting with in front, the incisors, moving backwards towards the corner tooth, the canine, and even further back, the premolars, and way in the back, the molars. Let's look at the oral anatomy of a tooth. Above the gums is the crown of the tooth, and this is covered with enamel, like we talked about, the hardest structure in the entire body. Underneath the enamel is a softer layer called the dentin. The dentin protects the innermost layer of the tooth, called the pulp chamber, which is comprised of the blood vessels and nerves and everything that keeps your tooth alive. Underneath the gums is the root of the tooth, which has the same sort of structure, although its outermost layer is called cementum. That's why, when our gums recede, causing recession, and the root structure is exposed, it is much more sensitive to outer triggers because this cementum is softer. It's like dentin, and it's just over the nerves and blood vessels of the teeth. Then there's the periodontal ligament, which is the cushion that allows the tooth to sit in the supporting bone. Remember, our teeth require the supporting bone around them to keep them strong and healthy, and so that they're not moving around on us. So let's review some relevant terminology. A biofilm is a complex film of bacteria which adheres to any hard surface in the presence of water. In this case, specifically teeth. A plaque is a bacterial biofilm which has grown large enough to be visible to the human eye and wipeable intraorally. This is what happens minutes to hours after we haven't brushed our teeth. Next, there's tartar or calculus, and this is plaque that, after a long time of not being wiped off, collects and absorbs minerals and debris, which becomes mineralized or hardened on the tooth structure, and that you can definitely see. All of these create something called inflammation, which is the body's response to foreign invaders, including bacteria and viruses, which causes reactivity and unhappiness of surrounding tissues. What is so whack about plaque? Well, bacteria and viruses thrive within dental plaque. That's what makes our mouths unhappy. Unbrushed dental plaque causes dental caries and periodontal disease, and a lot of other icky things. So let's review course topics of this oral health education series. Our second module, dental caries, will describe the disease process commonly known as tooth decay or cavities. Dental caries was described as a silent epidemic by the Surgeon General in 2010. Our third module will describe nutrition related to oral health. Nutrition and oral health have a very unique bidirectional relationship. Poor nutrition leads to reduced oral health. Poor oral health leads to reduced nutrition. Remember, you are what you eat, and it will affect your teeth. Our fourth module will review fluoride. Fluoride is the key ingredient within toothpastes, mouth rinses, and professional applications which help to prevent dental caries or tooth decay through the remineralization or strengthening of teeth. Fluoridation of public water systems has been named one of the top 10 achievements of the 21st century related to public health. Next, we'll review diseases and conditions commonly found within the oral cavity. Not only will we discuss dental caries and periodontal disease, but we will also talk about dental trauma, tobacco use and abuse, oral cancer, halitosis, xerostomia, bruxism and clenching, candidiasis, and oral manifestations of systemic diseases. Next, we'll review motivational interviewing, which is a key tool which helps others to achieve change. Just remember, different people with different experiences have very different needs and thus different solutions to achieve change. Motivational interviewing will allow you, the educator, to help empower others to identify and solve the problems that they need to create their own behavioral change. Next, we'll talk about teeth throughout the life course. Just remember, specific populations, including different age groups, have unique oral health needs and considerations across their lifetimes. And that's what we'll talk about here. We'll also review dental clinical care. Dental care has many different avenues, and there are many different members of the dental team, specialties, etc. Yet dental care is also an essential component of healthcare, but it's provided in a very unique setting that's often separate from medical systems. We'll talk about these both in this lecture. Lastly, we'll review navigating the dental system. This includes coverage of, access to, and even utilization of care, which can greatly vary across the U.S. The dental care delivery network is a rather fragmented system, so helping others to understand their coverage and maybe access places of access for care, that's essential in helping them to establish a dental home and routine dental care over their lifespans. So for today, let's review oral hygiene instruction. What is the best way to care for your teeth and your mouth? You may already have a great oral hygiene routine, but just remember, most people don't. First, what is the correct way to brush your teeth? Is there really a correct way? Have I been doing it wrong all this time? Well, it is never too late to brush up on your oral health technique. So first, be sure to angle your toothbrush towards your gums. Remember, it is just as important to brush your gums as it is your teeth. That's why, as you can see in this picture, using a 45-degree angle to angle upwards towards the tooth and the gums when you're working on the top, or downwards towards the tooth and gums when you're working on the bottom teeth, that's essential in brushing your teeth correctly. Second, ensure that you cover all surfaces of teeth and gums without brushing too hard. Can you brush too hard? Absolutely. Caution! Brushing too hard will likely cause gum tissues to wear away over time or pull back from the teeth, causing recession. Third, use circular motions with your toothbrush to cover the outer, inner, and the chewing surfaces of the teeth and the gums. Remember, continue this process for at least 2 minutes twice per day. If you can do it more than that, even better. Lastly, never forget to brush your tongue, which may harbor bacteria, plaque, smells, and who knows what else. Ick. Electric toothbrushes are strongly recommended, but be sure that you're purchasing one that's ADA approved if you go that route. They can be expensive. Sometimes electric toothbrushes can be too abrasive or hard on the teeth and the gums if it's a cheaper variety. Always, always, always use a soft or an extra soft toothbrush. And just remember, Medium or hard toothbrushes, they're made for cleaning dentures or for scrubbing toilets. Please don't brush with them. Well, what's in your paste? Fluoride is the key ingredient within toothpaste, which helps to keep teeth strong, prevent tooth decay, and prevent sensitivity. So just make sure that you're using a toothpaste with fluoride. While many kinds of toothpaste can make your breath feel great and the mouth to feel clean, it's truly the fluoride which helps to re-strengthen teeth and prevent tooth decay. And that's why it's essential to get it into your toothpaste. The floss. Well, it is not just a dance fad, though it does require the proper technique. So, flossing. Whether using conventional floss or little flossers, ensure that you're using the floss with a C shape to gently massage each adjacent tooth surface in between your teeth. As you can see here, it is very important that every time you floss in between those teeth, you're massaging gently on one side of the tooth and gently on the other side of the tooth. Now, if you're flossing at all, believe us, your teeth, gums, and your dental provider are happy. Consider an alcohol-free, fluoride-rich oral rinse. Nightly mouth rinse use will allow fluoride to soak on teeth overnight. But just remember, a lot of rinses don't have fluoride in them, so please read the label to see if yours contains fluoride. This is a very small time and cost investment, but it will prevent a lot in time and costs of dental care down the road. We recommend it. Choose helpful foods. Remember, the food and drink that you put into your mouth strongly reflects your overall health. You are what you eat, and so are your teeth. Consider chewing a sugar-free gum. Chewing sugar-free gum after meals has been proven as effective in reducing plaque and preventing oral health problems. Just don't pop too loud to annoy your coworkers. Also, avoid harmful habits. Harmful habits such as smoking, drug use, and alcohol use greatly worsen oral health and pose threats for serious conditions such as cancers. And lastly, establish and visit your dental provider regularly, but not for the expensive treatment. Remember, our focus is prevention. So, what next? Well, the purpose of this oral health education series is to provide you with the tools to become a successful oral health educator for others. Why is this important? In the most high-income countries in the world, like ours, 5% of total health expenses and 20% of out-of-pocket health expenses stem from costs related to dental care. We are lucky to have it. However, it is expensive, and a lot of people do not have access to it. And just remember, these dental problems vastly affect quality of life and our ability to perform tasks every day, our speech and communication, our productivity, our personal relationships, our employability, even our ability to eat and our overall health. It also affects our happiness and self-perception. Lastly, our longevity. Dental problems really can greatly hinder one's quality of life, so staying on top of them and preventing them is essential. Remember, the oral cavity or mouth is a lens through which we can view the overall health of an individual. Oral health is essential. You don't have to care for all of your teeth, just the ones you want to keep. So, we'll take you on a tour through these additional modules, but please email with questions or further read about certain topics if you find it interesting, because you will be the tool and the educator for so many people who may not have this knowledge or the means to access it. We shall never know the good that a simple smile can do. Thank you for your time, and thank you to our sponsors. With questions regarding this module, please contact BreckyHuddleston@gmail.com. Thank you very much. We'll see you next time.